Hi, I'm Steve Adubato. This is State of Affairs. We, in fact, are coming to you from the Agnes Varis NJTV studio in Newark, New Jersey. It's my pleasure to introduce Dr. Sharif Elnahal, who is the Commissioner of the New Jersey Department of Health. Commissioner, good to see you.
Thanks so much, Steve.
Tell folks a little bit about your background before you came into this post.
Sure. I actually grew up in New Jersey in Atlantic County. I grew up between Galloway Township and Linwood. Went to high school at Mainland Regional. And I've spent most of my career actually outside of New Jersey before being afforded the opportunity to come back here and serve. Ended up going to medical school up in Boston, also got an MBA up there, and decided to really focus on not just healthcare provision as a physician, but the systems of care that support folks on the front lines. And so got into operations management, quality, safety, ultimately policy, served in the Obama administration at the Department of Veterans Affairs, where the governor became aware of the work that we were doing, and I was really glad to come back and do this, this role. Yeah.
By the way, I was talking with the commissioner before we got on. This, in fact, is the unofficial start, if you will, of a series of programs simply focusing on the future of healthcare in New Jersey, also in the nation, but our mandate, if you will, is New Jersey. This is, in fact, the future of healthcare. And let me ask you, to that end, Commissioner, how confident are you about the future of healthcare in this state? A, and B, what are the biggest challenges we face?
I'm really confident about it, Steve. And the reason I say that is everybody I've met, from hospital executives to folks in the front lines like community health workers who are in our inner cities, finally reaching communities that we failed to reach thus far for some of our public health issues, all the way to business leaders and folks that you normally wouldn't think have a hand in healthcare, but ultimately do by improving the economy and improving people's well-being. All of them are ready to start building an innovation economy here in New Jersey.
What does that mean?
That means starting to bring in new ideas, new entrepreneurs, people who are actually creating new solutions for some of our toughest healthcare problems. And part of what we're focused on in the Department of Health is not just, of course, improving public health outcomes, but also bringing innovation to the table and to have New Jersey essentially become the Silicon Valley for healthcare and new technology, new solutions for these issues.
It's interesting. One of the issues that we were talking about before we got on the air involves technology as well. There's a report that was put out that really talks about the end of life issues. 25% of all New Jerseyans die in hospitals. Actually, the Nicholson Foundation funded a study that the Healthcare Quality Institute put together. Why is it relevant that so many people die in hospitals and so much money is spent on quote-unquote end-of-life care disproportionately in New Jersey? Why is that an important issue?
Steve, I spoke at that event recently commemorating this report and how important it is. It's a really important issue. The fact is, people are not getting treated the way they should near the end of life. And the first step is, of course, asking people well before they are in the emergency room or on their deathbed how they envision the final days of their life. Do they envision it at home? Are you treating their pain? Are you treating their symptoms early on? There are studies that show, Steve, that when you do that properly, not only does your quality of life improve as a patient, your well-being improves, your family members' well-being, and even your lifespan is extended if you're offered end-of-life care the right way earlier on in your disease process.
But there has to be an honest discussion about this.
It really has to.
And we're not where we need to be.
We're not. We do not record people's preferences for care, their goals of care. We provide the most aggressive care out of any state in the country.
Aggressive meaning expensive?
Expensive is part of it, but also we're doing procedures. We're keeping people alive, oftentimes not knowing what their preference would have been otherwise. And this is all about matching what people want out of their life into their care. And we're not doing that right.
Okay, quick on this. We're collaborating with the New Jersey Sharing Network, Organ and Tissue Donation. By the way, look at our website or connect to theirs to find out more about organ and tissue donation. What is the role of the Department of Health in the whole question of organ and tissue donation? Because there are at least 4,000 to 5,000 New Jerseyans waiting right now for an organ.
Yeah. So we, of course, maintain the registries and have a role in organ donation. A lot of that is carried out, of course, by the hospitals and the hospital system. We communicate regularly with them to understand what the supply and demand is for organs, and we have a role to play in that. It's an important one as well because we want to make sure that we're supporting the folks in the front lines doing transplants and connected well to the trauma system. We have an advisory committee on trauma that addresses some of these issues as well.
You know, I was watching, as most people do, NJTV News. We're actually taping right here in the studio at NJTV in Newark, and you were talking about, I'm not sure if it was a conference or what it was, but there was a comprehensive report on the opioid crisis in this state. You and your colleagues at the department are very involved. Talk about it.
Yeah. We are on track, Steve, to have over 3,000 deaths from opioid overdoses this year.
3,000.
3,000. That number is much too high. It's not getting better. In the last administration, there were a lot of good laws passed that's starting to get us there, but we haven't had yet a comprehensive public health approach. What does that mean? That means tracking the journey of someone from their initial exposure to opioids through addiction, through incarceration, overdose, and death, trying to make sure that people are not passing through each of those gates through effective interventions. Part of that battle, and the governor has been out front saying this as well, is extending medicinal marijuana to folks with chronic pain.
You believe that's the right thing?
I do. There's a lot of evidence to say that it's an effective treatment for pain of many types, both from joints and bones and muscles, all the way to organ pain. Study after study has shown that it's effective. We want to make sure we're getting it to as many people as possible who we think can benefit. And we want that decision to be made by physicians on the front line who are seeing these patients.
Steve Adebato here. We're in fact speaking to the Commissioner of the Department of Health, Dr. Sharif El-Nahal. Question about an interesting and complicated question about infant and toddler care. What is the role of the Department of Health? We actually have, Jackie, help me on this, Jackie, our producer. We have the head of the Department of Families and Children coming in, and we're doing an initiative dealing with questions revolving the health issues impacting infants and toddlers. Does the state have a role, the Department of Health have a role in that?
Absolutely.
Because I know it's broken down to a lot of the state agencies.
It is, but we work very closely with the Department of Children and Families on a lot of projects. One of the programs we have is called the Women, Infants, and Children Program. We're trying to...
WIC?
WIC, yes.
Right. Our initiative is right from the start, NJ. You'll see up on the screen. Go ahead.
Yeah, and the entire idea behind that program is to provide support, services, access to healthy food, for vulnerable communities, folks that are not being reached through food deserts and different things that allow them to access healthy food, but also things like breastfeeding training, making sure we're supporting mothers, new mothers in communities in the inner city that we're not able to get to with the traditional structure of the healthcare system.
Commissioner, why is, again, Commissioner El-Nahal is in the House, Steve Adebato here. The question is also about infant mortality and why the rate is so much higher for African-American babies.
It's really terrible, Steve. We have among the lowest infant mortality rates in the country, but you can't celebrate that knowing that at best the black infant mortality rate is double across the state, in some places quadruple. It's because we simply have not reached the communities that we need to reach with our outreach efforts. We don't have the infrastructure there for people to receive prenatal care. The social stressors on black women in New Jersey, we found...
Toxic stress, as one of the doctors actually we talked to called it. It is toxic.
Absolutely.
What does that mean?
That means that they are not of to tend to themselves and by definition to their child. If they have so many different social stressors, there's employment issues. Many of these women are being forced to go back to work in a matter of days after they give birth. So we're talking about levels of stress that most women in New Jersey are not experiencing. And so we need to get to the root cause of these issues. It's one of the first things I asked my public health team to do, and we're already on track to do a lot for that problem.
By the way, before we have another couple questions for the Commissioner, log on to our website. There's an article by Dr. Arturo Brito, who wrote about this whole question of toxic stress, which I never had heard before he said it, but real quick on this. The future of the Affordable Care Act in New Jersey and the nation is?
That is an open question, Steve. I'll tell you what we're trying to do in New Jersey. We're trying to stave off the continued attacks on the gains we've made with the Affordable Care Act that are coming from the Trump administration. We passed historic legislation establishing the first individual mandate since Massachusetts did it well before the Affordable Care Act. That'll hopefully stabilize the exchanges. We're also going to have a reinsurance plan that essentially covers the cost of some of the sickest patients in the exchange. That should help lower premiums and, of course, therefore have more people enrolling. And, of course, we're going to promote the Affordable Care Act open enrollment period way more than we have been before.
Even though the
in New
federal
Jersey.
government has cut back on the amount of money you can use to, quote unquote, promote and educate. Am I wrong about that?
No, they've cut
Go ahead,
back
I'm
on
sorry.
the money. They've cut back on the open enrollment period. So it used to be 3 months. Now it's only 6 weeks. So these are all intentional actions that are being taken in Washington to undermine the Affordable Care Act. And the people paying for it, Steve, are the patients, the people who've benefited from coverage, the people who've gotten treatment for diseases they've had for a long time but were denied based on their pre-existing conditions.
You're listening to Dr. Sharif Elnahal, Commissioner of the Department of Health in the state of New Jersey. I want to thank you for joining us here on State of Affairs. Hopefully you'll continue to be a part of our conversation on the future of healthcare in New Jersey and the nation. We appreciate you joining us.
Thanks so much.
Thank you, Commissioner. All the best.
Thank you.
Okay. We'll be right back right after this.
State of Affairs with Steve Adubato is a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by RWJ Barnabas Health, Delta Dental of New Jersey, the Turl Fund, supporting Right from the Start NJ, the Nicholson Foundation, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, NJ Best, and by New Jersey Sharing Network. Promotional support provided by Jaffe Communications, where business, media, and government converge in New Jersey. And by New Jersey Monthly, the magazine of the Garden State, available at newsstands.